Today, we are going to begin our final discussion on treatment for mood disorders, and today's topic is going to be psychotherapy. So, in psychotherapy, we are going to begin with understanding cognitive behavior therapy. Cognitive behavior therapy is, as you know, one of the most commonly used therapy method for unipolar depression. So this was initially developed by Aaron Temkin Beck. So his therapy is based on the theory of the cognitive triad, which believes that your thoughts, emotions, and behaviors, all of it influence each other. So which means your thoughts would influence how you feel and behave. Your behavior is influenced by how you think and how you feel. Your feelings are in turn influenced by how you think and how you behave. So all of this, kind of influence each other. So this theory, this therapy basically focuses on helping patients systematically evaluate their dysfunctional beliefs and negative automatic thoughts. So if you're wondering how it is done, this is done by providing different techniques. Okay, so to uncover such depressing symptoms. So such dysfunctional thoughts have to be uncovered by systematically testing them. So these tests are based on organized techniques of CBT. So these are a host of few techniques that generally clients who go through CBT kind of have most of these techniques adopted based on their needs. So with regards to this therapy, it is a relatively brief therapy and it lasts only about 10 to 12 sessions. Next, you're going to look at mindfulness based cognitive therapy. This is another variant of cognitive therapy wherein the focus is not on altering the negative thoughts as we saw in cognitive therapy, but here the focus is on becoming aware and accepting thoughts just as thoughts, okay, not the reflection of reality. So for example, say you're walking down a park and you have a sudden negative automatic thought like, oh, I'm not worth it. Okay, so here in MBCT the approach would be, okay, yes, that's a sudden thought. Okay, so you become aware of it. So that's a sudden thought. Okay, so awareness is there, and then you say that is my thought, so that is acceptance. Okay, so that is your thought, and then you also try to relate to the idea that it is just a thought and it's not reality. So you're accepting the present moment as well. So that's basically how an MBCT therapist would actually look at how to progress in a therapy. So such therapies of both MBCT and CT have proven to have a lot of potency in terms of which can be even compared to medication. So they have been associated to a lot of reduction in symptoms, to a lot of drop down in recurrences of relapses. So it's been very useful. And CT and MBCT during periods of remission have also been proven to be effective even to treat patients with bipolar disorder. The next therapy that we're going to look at is behavioral activation treatment. So, this therapy focuses on engagement of the client with his or her environment and interpersonal relationships. So, activities of a day tend to be structured and are rated based on its pleasurability and mastery. So, for example, the client is asked to write down things that make them feel really good or that makes them feel really bad. Okay, and for example, as you can see here, cooking, having lunch with friends, going for a walk. So all these things are things that makes the client feel really good. So for example, the therapist here would ask the client to list out such activities that the client feels really good about doing, and then the therapist would ask the client to structure it such that what would you like to do in the morning, what would you like to do in the evening, so things like that. And then after that, the client is also asked to rate each of the activities that the client has listed. So rating in terms of pleasure, whether she finds happiness in doing it, what are the level of happiness. For example, say the client gets very excited cooking but not really excited during an exercise. So, that could be rated in terms of pleasurability. On the other hand, mastery deals with your access, your control, and other aspects. So basically, you kind of allow the client to list out, rate it, and also organize it. And then what you do is you use different behavior modification techniques. So for example, say your client reports of having extreme pleasure, say baking a cake. So you say, you use different reinforcement techniques like positive reinforcements, okay, to enable the client to go through a baking process at least once a day, so that she enhances such behaviors that alleviate symptoms of depression. So slowly, whenever she engages in a baking behavior, you give her a positive reinforcement, so depression slowly begins to subside. So this therapy is generally very easier to be trained into when compared to other cognitive behavior therapy, and it is also proven to be equally very effective in terms of treatment. But however, as we all know, cognitive behavior therapy kind of stands out in terms of treating depression, but over time, this has also gained importance. Next thing that we're going to look at is interpersonal therapy. So, this therapy focuses on helping out the client, basically changing maladaptive interaction pattern. Okay, so for example, say the client is not using patterns that demonstrate acceptance, that demonstrates good expression of emotions. All of that could influence the way another person would interact with the client. So basically, when such maladaptive interaction styles are noticed and treated, it can help enhance the client's social support circle, which in turn could be very profitable for the client. So this is very suitable for people with unipolar depression, and when clubbed with medication, it's found to be extremely effective. So another variant of interpersonal therapy is interpersonal and social rhythm therapy. So here, if you're wondering what is this interpersonal social rhythm, so social rhythm is nothing but the regularity with which one engages in any kind of social activities. For example, it could be your interaction patterns during meals, it could be your interaction patterns before you go to bed, or during a day, the hot spots of your day. For example, when you feel extremely angry, say you're a person who's always angry whenever you get up, or things like that. So different social rhythms. So basically, as you know, in bipolar disorders, your biological rhythm, when it's disrupted, it can influence you to have a relapse. So similarly, if there are disruptions in social rhythms, how it could be influential in affecting your biological rhythm, which in turn could influence a relapse. So it could be very effective if you're able to understand such changes and if you're able to treat such changes. So this therapy focuses on dealing with those aspects so that you are better able to take in your medications, you're better able to manage stressful life events, and you're able to reduce such disruptions in social rhythms. So this basically leaves the client well equipped in dealing with future episodes, and to enable the client to prevent such future episodes in itself. So when done in combination with medication, it has found to be very effective in terms of a therapy as such. The next therapy we're going to focus on is family and marital therapy. The family environment of the client seems to be very important, just as how you see in schizophrenia. So for example, in schizophrenia, we studied about how expressed emotions like criticism, hostility, and emotional over involvement tends to be related to higher rates of relapse. So this is also very much related to mood disorders. So criticism especially seems to be very harmful and is related to relapse. So with regards to family therapy, the focus here is on reducing such, expressed emotions within the family to enhance better social support in the family. So this could be done in terms of group family therapy, by trying to interact with the family, by trying to psychoeducate the family about symptoms, and then accordingly give different therapies for them, and also majorly educating them on expressed emotions and its effects. The next thing is marital therapy. So marital therapy is very effective, especially when there is marital discord at very high levels. Okay, so for example, whether it's mild or high, when there are marital discords evident in the family, it could really affect the client's functioning. So irrespective of whether you're treating the depressogenic symptoms, you may not see any results because of marital discord. So marital discord has to be, you know the first thing that you deal with. So this can be dealt with in marital therapy by focusing on reduction of conflicts. So this can really help in the prognosis of a client with depression. The final thing that we are going to discuss for today is relapse prevention strategies. Relapse is nothing but the reoccurrences of symptoms. So basically, in order to help the client cope with relapse, there are various checklists that are devised. So these checklists basically list out any details that, wherein the client has behaved a little different than the usual. So it could be simple things as behaving in a very different manner, or that is away from the normal. Okay, so for example, eating in an abnormal manner, expressing emotions in an abnormal manner, or processing things in an abnormal manner, trying to respond in an abnormal manner. Things that are away from the normal are kind of noted down. This can be noted down sometimes by the client himself or herself as they notice such changes, or also by significant others in the family, or it could even be in a workplace or other friends. And such changes are then graded. So graded in terms of appearance. For example, what appears first, then what appears in the middle, and then what appears later. So basically it gives you a structure of what are the early signs of relapse, and what are the mid signs of relapse, and what are the later signs of relapse. So once you get to know the early signs of relapse, it can help you prevent further relapses. So this, when done coupled with CBT, it's found to be very effective. So this is also used as a common method because relapse has been a major issue in dealing with mood disorders with rapid cycling and recurrent cycles. So this has been a very effective method. So here we come to our end of discussion of mood disorders in terms of treatment. So I hope you've all understood and enjoyed the videos that I have presented so far with regards to treatment. So if you do have any doubts, kindly notify. Thank you.